The Health Minister, Mark Butler, is speaking. He's talking about the passing of the Cheaper Medicines Bill.
The Commonwealth pays every year to state governments is based on the advice that they give to us via the Hospital Funding Administrator about the level of activity that they're having in their hospitals. Now, COVID has obviously had an impact, for example, on the amount of elective surgery, particularly the two big states have been able to undertake. We are doing what governments for years now have done, and that is paying for the activity that takes place in the hospitals based on the advice from the state governments. So the budget numbers in the papers around hospital funding reflect the advice that each of the state governments have given to the Hospital Funding Administrator, and the Administrator has then given to the Commonwealth Government. Nothing more, nothing less. Reflected in an agreement that those state governments signed with the former government. Now, I'm very clear, as I think everyone else is in the health sector, that activity is going to rebound. That activity inevitably is going to start to surge over the coming little while as we get through the COVID pandemic. And for every additional piece of activity in the hospitals, whether it's a piece of elective surgery or some other admission, the Commonwealth will fund its share of that in accordance with the agreement the former government and all state governments signed.
To help them cope with COVID. In saying that, doctors are arguing that there's not enough as it is. Why are you still putting that money if they're struggling at the moment?
Well, we're not cutting money. We're implementing the hospital funding agreement that the former government signed with all state governments. And that provides that state governments say to the hospital administrator or report to the hospital administrator what activity they're undertaking in the hospitals, and we pay them for that activity. That's been the position for some years. It's the position set out in the agreement the former government signed with state governments. So as activity rebounds, as we move into different phases of the pandemic, we will continue to meet our obligations under the hospital funding agreement, and you will see funding start to return to more normal levels, I'm sure, in future reports the Commonwealth make, as well as future reports that states make. All we're doing, though, is implementing the agreements that the former government and all state governments signed a couple of years ago.